In the game of football, players face tough opponents. And former NFL offensive lineman Chris Draft knows what it means to play hard. That's why his new game plan is to beat lung cancer.
What we found consistently is there is hope. There is hope for lung cancer.
You may remember we introduced you to Chris last year, just after he formed Team Draft with his wife Keisha Rutledge Draft at their wedding. Keisha grew up in Williamston. She was athletic, healthy, and a non-smoker, but was diagnosed with stage 4 lung cancer.
She came to me and she said, how about we don't get presents? How about we just ask people to support this fight against lung cancer, which has morphed into a national campaign to change the face of lung cancer.
A month after their wedding, Keisha died. And since then, Chris's new playbook looks more like this.
Mary Hendricks.
He makes moves from city to city, touring cancer centers and treatment facilities.
Into this sequencer here.
And passing on hope to survivors based on what he's learned in honor of Keisha and her message.
So hold on, keep fighting, keep living, and something's coming. Something is coming.
We caught up with him here in Greenville at iTour.
What's the time turnaround from getting this information to where that would actually benefit a patient?
Which is the Institute for Translational Oncology Research with the Greenville Hospital System. iTour provides advanced cancer treatment through on-site research.
We're seeing relatively young patients, perhaps even in their 40s, present with cough, chest pain, shortness of breath, who have lung cancer that we cannot link to a personal history of smoking.
Dr. William Gluck is an oncologist with the Greenville Hospital System, where new genetic testing is being done in hopes of detecting lung cancer early.
We're saying that this isn't just that you have lung cancer, but this is your specific DNA pattern.
The test looks at the activity of genes in cancer cells to determine which patients would benefit from certain aggressive treatments.
And that's the clue for us to say, these are the normal gene patterns, these are the abnormal ones. Not that they were born with them, but they were acquired.
And here in this iTour lab, clinical trials are taking place, along with testing for cancer mutations on machines. Dr. Gluck says patients are also seeing progress with less aggressive treatment.
Many of these patients actually benefit from a pill as opposed to the use of general chemotherapy.
One of those pills is crizotinib. The drug blocks a gene which causes cancer growth.
We've had patients go from being practically disabled to pretty functional in 2 weeks.
But for patients who still need surgery, some of them are introduced to this Da Vinci robot. Its arms, cameras, and precision are operated by Dr. William Bolton and Dr. Jim Stevenson, a thoracic surgeon.
We think it's very precise. We're amazed at what the robot lets us do with the instruments.
This is an example of what doctors see while operating.
4 to 5 trocars are inserted into the chest cavity, one with a camera and the remaining with instruments which the surgeon controls.
So while doctors are controlling over here, patients are here.
What's unique about the robotic system is it provides three-dimensional optics and magnification and the ability to operate with very small incisions without dividing or cutting ribs.
Stevenson says that could mean less pain and quicker recovery time for patients. And they hope research being done here can bring hope to cancer patients everywhere.
Jackie Archer.
Jennifer Phillips, Fox Carolina News Tonight.